So hello and welcome. I want to thank everyone for joining our webinar. Today we'll be discussing some of our best practices for HIPAA and email security. We are very excited to have the CEO and founder of POBox, Hawala Greavy, join us today. So welcome, Hawala.
Hey Hillary, thanks for having me.
We're very excited to have you here. And I'm your host, Hillary Turk. I honestly have one of the greatest jobs in the world, and this is because I get to positively impact people's health and quality of life at work. And I get to do this by working with organizations on implementing wellness strategies with Optimity. We are excited to have all of our guests join us today for the webinar, and as we are waiting for everyone to get settled, let's take a moment to go over some logistics. So to connect to the audio, use your computer's microphone and speakers, or select Use Telephone after joining the webinar to turn on the sound. Of course, all guest lines are muted to avoid any background noise. And if you have any questions, please type them in the tool at the bottom, and we'll reach out to you after the webinar to answer them. The slides and webinar recording will be sent out to you so that you can share with others on your team. In the handout section, there is a Willis Wellness Industry Trend Report and an Optimity Executive Summary. Okay, let's get started. I'm just going to do a quick intro about Optimity, and we are a digital wellness platform that helps employees to be successful at work through something that we call micro-habit training. With our clients, we have helped to improve their quality of life at work, and Optimity is used by organizational leaders to understand the pain points of their employees' health. For any organization, we strategically target your highest cost health issues and achieve a quantifiable ROI. We have proven results with all of our clients, and I have worked with numerous organizations in implementing targeted wellness programs that has reduced their drug claims, absenteeism, and short-term leave. We have also been able to help our clients achieve an ROI of between $1.80 to $6.93 back for every dollar that they have spent on wellness. And this was a really exciting achievement for us, as the industry average is only $1.50. Our customers are able to run more initiatives faster and easier, and to just effortlessly coordinate between multiple sites. Our cohesive wellness portal provides you with a database to drive your decisions on how to customize and adapt your programs to get better outcomes. As you can see, some of our clients include PwC, Ontario Centres of Excellence, and CST Consultants. With each of them, we've been able to help increase the participation, which has had a positive impact on culture. And with that, we were able to increase PwC's engagement by 7 times. We are also able to help our clients save time and resources. At OCE, they are able to save 200 hours for their HR colleagues. And most importantly, we were able to quantify drug claims like we did for CST, and this is why we were able to get them a hard ROI. By creating a customized program, we are able to dramatically change the way our clients deliver wellness and report ROI. Today we have a dynamic and info-packed webinar, and we will give you the strategies that you can bring right back to your organization. So here's a quick agenda just so you know exactly what to expect. I'll shortly be introducing Hawala and handing over the floor to him, where he will share his experiences with HIPAA compliance and email security in the workplace. He will also go into define what HIPAA is and why employers need to be concerned about it. Then he's going to share some tips for keeping all employees' emails safe in the workplace. Then I will share some of our digital wellness strategies, some of Optimity's case studies, and give you some of our best practices and tips on how we keep our employee health behavior private. Again, my name is Hillary, and I'm a wellness advisor here at Optimity. My background is in human kinetics and health promotion. My work at Optimity is just to mainly help clients customize programs and strategies to help target their highest cost health issues and to really drive better outcomes. I'm now going to pass over the floor to our guest expert, Huala Greavy, the CEO and founder of POBOX, and I'm so excited to have him here with us today to share some of his best practices for HIPAA compliance and email security at work. So Huala, why don't you introduce yourself to our guests?
Hi, Hillary. Thanks for the intro. So, yeah, hi, everyone. My name is Huala Greavy. I'm the founder CEO of POBOX. I've been doing email for a long time. We're from Hawaii. We built this product in Hawaii, and then we moved to San Francisco 2 years ago. We think we're on to a big idea, so we felt like we needed to be in a big market. And my hobby is kayak fishing, so that's pretty much me in a nutshell. So we can start off today just doing a brief overview of HIPAA and why the people on this webinar should be concerned about it, and just a little bit more background on where the industry is going. So HIPAA, just so we get on the same page, it's the Health Insurance Portability and Accountability Act. So employees do have the right to their personal health information, or PHI. PHI, unfortunately, is of high value to hackers now, even more so than a stolen credit card. And if you want to learn more about just what the dynamics are behind that, you can click that link, most valued by hackers. Of course, this will be available offline afterwards as well. And we're also seeing, as far as HIPAA violations go, breaches have increased dramatically year over year for the past 10 years, ever since public data has been available for that. Fines for a HIPAA violation are also going up, and one single violation alone can total up to $1.5 million. So some HIPAA compliance trends that we've been seeing, and we follow this market pretty closely. So in 2004, when the first publicly available data was available for HIPAA breaches were made, there were less than 1,000 reported violations. Since then, the last year of data we have on file that's publicly available is 2014. It's gone up to more than 6,000 violations. So these are some really high trends we're seeing. And on top of that, right now, most of the violations are revolving around stolen computers, laptops, and thumb drives. And those laptops, computers, and thumb drives do not have disk encryption on them. And that leads to some big fines. We're also seeing email breaches are quickly catching up. And I'll get to a little bit more about that later in the presentation. And one of the newer trends in HIPAA right now is HIPAA Phase 2. That began about 14 months ago in early 2016. And the Department of Health and Human Services, HHS, what they've granted themselves in Phase 2 is the ability to perform random audits, similar to an IRS audit. So now covered entities and business associates, those are people that provide services to the covered entities under HIPAA, they are both able to be selected for a random audit. So you don't even have to have a breach to get audited now that Phase 2 is in place. So again, HIPAA is the Health Insurance Portability and Accountability Act. It was enacted in '96 when President Clinton was in office, so it's been around a long time. We believe it's not going anywhere regardless of who is in office. So I think this thing is here to stay. And once again, individuals have the right to their protected health information, PHI. And HIPAA sets the standard for how PHI needs to be protected. And there's 3 components to it, which I'll get into on the next slide, but they're technical, physical, and administrative. And I have a link there at the bottom if you want to learn more about those 3 safeguards. So I understand most of you on this webinar are in the HR space. I hope I'm correct in that assumption. So we tried to tailor our presentation for you folks. So, the big question is, do I have to be HIPAA compliant as an employer? And it really depends. One, are you a covered entity? Or two, are you a business associate? And we see there's some pretty basic guidelines around determining whether you're a covered entity or business associate. Covered entities typically provide healthcare or process payments for healthcare or provide operations for healthcare. And we listed some examples there below, like medical billing, health plans, and senior living facilities. And then the other side is a business associate. And those are organizations like us at PowBox that handle protected health information on behalf of a covered entity. Now, I've included a pretty cool tool that we use internally when we write blog posts and research papers. And it's a covered entity tool provided by the Centers for Medicaid Service, CMS. So just click that link. If you have any questions on whether you think you are or you think you don't need to be HIPAA compliant, it's got a really easy tool you can follow. I think it's like 3 questions. And then that'll give you a definitive answer for you. So that's a handy link you can check out later. So, for everyone else, we know that people in HR are always dealing with sensitive information. But, if you use that tool and you're not in the healthcare space, you most likely will not apply to employment records. And we also want to note that the Americans with Disabilities Act, ADA, has their own set of governance. So in general, HIPAA applies to the covered entity, not to the HR professional requesting information, in general. So HR can request protected health information, and I'm sure you guys all know this, if you're asking for things like sick leave, workers' comp, wellness, or health insurance. Of course, common sense says you still need to get the employee's authorization. So now we're going to switch into protecting your data. This is how people get stung with HIPAA compliance fines. So first part is administrative safeguards. There's a whole set of documented processes you need to have on file, whether that's a paper trail or a digital trail. You need to be processing on who can access employee information and when. And you also need to be continually undergoing continuing education for your workforce for HIPAA compliance. So the administrative side is just having your ducks in order and having things documented for processes in place. On the physical side, most time that relates to making sure your hard drives, your thumb drives, even the computers within your office have disk encryption, so the data at rest is encrypted, and of course having a robust password strategy. So a common one would be, at least 8 characters, alphanumeric. That's a really common password strategy these days. And then on the technical safeguards, we just believe it's just better, and just from an architectural standpoint, if you just encrypt all communications. So that's what we've done at PowBox since day one. We just encrypt everything. That way we don't have to worry about whether this or that's encrypted or not, just 100% encrypted. For you guys in a large organizations, I don't know if that's as feasible if you've got a bunch of legacy architecture systems in place, but we just feel like that's where the industry's going. And if I can just spend a minute just talking more about these 3 safeguards. So what we're seeing in the market is there'll be a breach, and anytime 500 or more patient records are affected in a breach, you're required by law to report that to the Health and Human Services website, hhs.gov. Most times it'll be a physical or a technical breach. And then when the investigation is conducted by HHS, a lot of times they'll find that the administrative safeguards are not in place or haven't been updated. And that's really where the big fines come into play. When you have 2 or 3 of these safeguards out of compliance, then we just see some astronomical HIPAA fines. For example, I think in January, or it was either January or February of this year, there were close to $10 million in fines issued just to 2 entities. So an average of $5 million in a single month for HIPAA fines. So we believe email is still the most common way to get hacked. The reason being, most employees in a workforce have email. And if you've got a large organization, I mean, even with 100 people in your organization, you know, there's going to be 2 to 3% of those users that'll click on anything, no matter what. Unfortunately, that's just the way it is that I've seen in these larger organizations. And phishing attacks are on the rise, and they commingle with ransomware attacks, which we'll get into a little bit later. And I'm sure you guys have all heard about phishing attacks, but it's basically you get an email from someone pretending to be someone they're not, and they're asking you to put in your credentials for your bank account or even your email account. A lot of times these links look funny, the logos look funny, there's an attachment with some macro in it, which is hard to identify from an end user standpoint. But you know, the phishing attacks, it's just preying on the gullibility of a human. And anytime you've got more than 100 users, I tell you, man, there's going to be at least 2 or 3 of them that'll just click on anything, regardless of the training you give. So we'll get into a little bit more about how to best safeguard against that in the next slide. So, like I said, I've been doing email for a long time, since 1999, and specifically in the email security and encryption space. So I believe in the age of the iPhone, the iPad, all these devices, you need to have a robust email security scanning mechanism at the network perimeter and not at the computer level, because you know, people are checking email on all sorts of devices now. People are no longer checking email just on Microsoft Outlook on their work computer. So this might be over the heads of most of you in the audience, but I think this is some good takeaways for you to talk about to IT folks. There needs to be robust email scanning at the perimeter. And we also recommend maintaining and taking advantage of SPF records. This is Sender Policy Framework. In a nutshell, it's just it's a DNS record you can create that tells the rest of the internet who is authorized to send email on your behalf, whether that's IP addresses or host names. It's a voluntary, optional piece of email setup you can have, highly recommended. And that's just to let the rest of the internet know that if someone's trying to impersonate your domain name, you're telling the internet, hey, that's not who we are. We are actually this piece of the internet. And we use that on our side at Powbox, of course. Another one that it's kind of a custom thing we built, but I do see it happen all the time, is a common attack strategy will be to register, these are the bad guys now. So they'll go and register a domain name that sounds maybe sort of similar to the organization they're trying to impersonate. And they'll pump out a bunch of spam or phishing attacks and using that domain, that new domain name. And then it'll take the rest of the internet about 2 to 4 hours to figure out the scam. But by the time everyone's caught up to the new scam, they've already created another new domain name. Again, just a letter or a character off with the same scam. So what we've done at Powbox is we say, hey, you know, if you're going to send email from a domain name that's been created, say, within the last 2 or 3 days, uh, we're not going to talk to you. We think that's bogus. Because I think the real email usage, people have had their domain name longer than a week before they send it or start sending out email. So it's just a thing we call domain age, and it'll really cut down on these more sophisticated phishing attacks. Another tool we like to use at Powbox is the Google Safe Browsing API. I'm sure you guys have seen this. Sometimes when you go to a suspicious website using Google Chrome, the browser will flash a big, like, blinking red screen at you, and it'll say, hey, this URL, this domain name, has been reported to be a phishing site, a scam site, something bogus. Are you sure you want to look at this thing? And most times you don't, right? Because it's very accurate. Well, it's called Google Safe Browsing. Well, that interface is available to be queried against. So what we did at Powbox is we say, hey, for the email coming in for our customers, if there's a link in the email that matches up to the Google Safe Browsing API, hey man, we're gonna nuke that. That's bogus. So that Safe Browsing API constantly updates itself. So that's a nice little tool you can use in your arsenal. It's free to use. It's publicly available. You just have to have the wherewithal to integrate it into your email security system. And then lastly, and this is where the forefront of the battle is, and this is how ransomware gets into your network most of the time. This includes Office documents and now even PDF documents that have macros embedded within the document. Macros it's basically a script using PowerShell or Visual Basic, VB script, that executes a set of commands when you open a document. So a lot of people like to use this in Excel to create more powerful spreadsheets. Unfortunately, these macros are being widely abused right now to execute PowerShell commands to infect your computer with ransomware. Ransomware, of course, is where ransomware gets in your network. It encrypts your hard drive or a series of your hard drives, and then you get a friendly email or blinking screen saying, hey, if you want to unlock these hard drives we've encrypted, we want you to pay us in Bitcoin, which is a virtual currency that's nearly impossible to trace, and then we'll let you unlock it. Unfortunately, that's a PR disaster for the organization. It doesn't always guarantee your data will be unlocked, and it does say a lot of other things about how your network is set up, which I'll be getting into in a bit. But I think with the Office docs with macros, for the end user, man, it is just really hard to tell sometimes on these more sophisticated attacks. And again, it just points to, hey, you need to have a strong perimeter email security plan in place so that you don't leave it up to the end user to decide whether or not it's fake or not. That's just our experiences. There's always going to be 2-3% of users that will just try and open something no matter what. So better not to even let them have that opportunity. And then I know in the larger organizations this might not be a viable option, but for us at Powbox, we're all Macs because we're in the security business, and all of these ransomware attacks only affect Windows computers. So we went with the nuclear option from day one, and we're 100% Macs. Now, I'm not saying there's no viruses for Macs out there, but the ransomware is certainly a Windows-only phenomenon. So if you're small enough or agile enough, that might be something to look at. It's definitely a really good hedge strategy. But again, if you're in a large organization or you have custom software you use, this might not be a viable option. So I just called it the nuclear option.
Well, thank you, Vola, for sharing your expert advice. Now I'm going to give you a quick background about Optimity and really zero in on what we can do to help boost your employees' health at the workplace while keeping your data secure. At Optimity, we work to support you with a gamified and fun solution for workplace wellness. We work with companies of all sizes to create good practices to improve employees' quality of life at work and also drive down risk for chronic health conditions. When I work with clients, I do see the classic problems in modern employee success practices. First, there are multiple demands, and this is coming from both leadership and employees, so they have a lot of great ideas. However, it's really hard to prioritize them. It is now becoming harder to coordinate. There are more dispersed workforces with people working more flex shifts, and lots of organizations have a bimodal age distribution. By that, I mean you have mature baby boomers on one end and millennials on the other, and you really have to be able to serve their different needs to keep wellness accessible to all of them. There are new requirements, such as a need to provide mental health support and for financial wellness education. As you're well aware, there is a high employee to HR ratio, which means that they are tasked to do much more with much less resources. And finally, demands are becoming more metrics driven. So I'm seeing that clients are using more spreadsheets, sending out more emails, where really you need a centralized dashboard and automatic smart analytics. So that's what we help with at Optimity. We make your life easier and keep your employees healthier. So looking at a larger organization that we've worked with, such as PwC, they have very fast-paced and mentally demanding jobs. By using some of the same practices that we use here at Optimity, we're able to help them with some of their HR issues, such as sick leave, turnover, and workplace stress. We launched with our audit team during audit season, and they were really busy working for their clients. We provided them with a buffet of content to help reduce the negative side effects of the demanding job. We really worked on their culture and having them connect more as a team, and for example, we did this through team lunches, mindfulness activities, and healthy competition, which helped to increase their engagement by 7 times. And increased employee engagement tends to lead to a decrease in drug costs such as antidepressants and sleep aids. So let's look at another use case of ours with Ontario Centres of Excellence, which had a very dispersed workforce over multiple locations, and they only had 2 HR professionals. They were noticing a lot of turn issues, so they're organizing great initiatives, but we're spending a lot of time and resources organizing it for all of their employees. And this is because everyone wants and needs different things relating to workplace initiatives. When Optimity was implemented, they were able to centralize all of their initiatives into one dashboard and send out personalized content for all of their employees. We were able to centralize their event announcements by sending out mobile notifications and having automated email templates. So this really helped to boost participation in their programs. And everything was pre-scheduled, and they were going from spending 5 hours a week to only 15 minutes. We were really able to cut out a lot of the noise so they could focus on the programs that their employees really wanted and found useful. These are more quantitative results from some of our partners, and we were dramatically able to decrease the rates of absenteeism and sick leave and really boost employee engagement, which led to much better outcomes. As we all know, employee health costs are on the rise and increasing in drug benefits, absenteeism, sick leave, and turnover. And the trend right now in North America is that these health costs are rising 10 to 20% year over year. And another shocking statistic for you is that 70% of North Americans are on at least one prescription drug, and this is mostly because of preventable issues such as back pain, insomnia, and stress. And it is becoming a huge cost to companies as they are losing over $1 trillion to these preventable health issues. So like I said, the increase in these drug and health claims are continuing to increase year over year, And every day you don't implement an employee wellness strategy is another day that you are losing dollars to these increases. The reality is that traditional wellness programs tend to engage the super fit employees, where in reality they need to engage the more dormant and inactive employees. The programs usually don't provide a hard ROI, and they truly fail to dig deep below the iceberg and impact these metrics. And these are the ones that are costing you dollars. We understand the disconnect here with traditional wellness programs, and this is why we make a digital wellness platform that works through wearables and mobile apps to help you integrate healthy micro-activities into your everyday routines. So this can be as easy as rolling back your shoulders to help improve your posture, which I'm sure all of us could do right now as we're sitting down. And each time you do these activities, you get points, which you can then redeem for rewards, such as a $20 Starbucks gift card, which is my personal favorite. And you get to track all of your progress on one leaderboard. We also help your company reduce their business costs. So this is a snapshot of our admin control, and this is really where the power of the program lays. This is where we will be presenting all of your employees' health behaviors to you on an aggregate level. So you'll be able to see real-time data on their health increasing, participation, and engagement. But we never give out individual employees' health data. We only do it on an aggregate level. So let me just do a quick recap on how our platform works and all the components to our fully integrated ecosystem. So again, we have a customized mobile app that's available in 3 languages and accessible on any mobile device. We also connect to over 250 wearables and apps, and we can provide those wearables as well. Our centralized dashboard allows you to see real-time data and just easily implement your holistic wellness practices. We also have advanced analytics that helps to retarget content to address your highest cost health issues. So like I said, traditional wellness programs such as yoga classes and gym membership reimbursements tend to be adopted by the super fit. And on the other side, for the disease management programs such as on-site nurses and EAP programs, they tend to be used by the already sick. So only Optimity focuses on the middle majority, and this is where most of your current drug costs, absenteeism, and benefits are coming from. And we also help to contain all of those future costs as well. So by engaging our clients' middle majority, we're able to achieve an industry-high average participation rate of 77%. And this was another really exciting achievement for us, as the industry average is only 10 to 15%. Now I'm going to share some of our best practices and tips on how we keep privacy with the employee data. So our first tip is to put safeguards in place. So you need to understand who has access to all of the data. So start by clearly stating some ground rules and guidelines for your wellness admin team so that you can make sure that all your health data isn't at risk. Next, you want to make sure that everything is password encrypted. So our app and admin panel are both password encrypted, and everyone can create their own, and it's stored as a double encryption. So by that, I mean if you create a password, for example, you say Hillary123, which really isn't a good password, so please don't use that. When it's being stored, it's encrypted in our backend, so that way it can't be matched back to you or recreated. And we have automated communication that's sent out to all the users on specific user segments. So that ensures only the people who are within our system receive all the information and updates. My second tip is to limit sharing of the information. As I mentioned before, all of our reports are delivered to you on an aggregate level, so we never share any of the individual employees' health behaviors. We only give it to you on an aggregate level. And our segments are anonymized. By this, I mean through our panel you can search employees who are female, they're 40 years old, and they just participated in your nutrition program. And so through that, you can send them specified content for nutrition or saying congratulations for attending our nutrition program. And again, everything is anonymized, so you can't see those individual employees. You can only see that X amount participated, but you don't see, oh, Johnny participated in this. You only see just them. And through our app, the user can choose to be anonymous. So it's a simple step through the settings. So once they become anonymous, they're not able to be seen on the user board, and they're also removed from any of the activity news feeds. So this is just if people want to keep their activity private and they just still want to use the app, but they don't have to share it with everyone on their team. Lastly is you want to limit the access. So what we do is we train all the admins on our admin protocol, and only the admins that we train have access and control to our platform. And again, we don't allow them to see any individual employee behaviors. We only deliver to them on an aggregate level. Our data storage is safely encrypted, so we don't take any additional health data that we are not doing something with. So this is very compliant with HIPAA and HIPAA and HIPAA protocols. So again, we don't use anything that we don't need. We just make sure that everything is following the HIPAA compliancy. And if you need any help on any of this, reach out to Hoala or myself, because we are very happy to help you. So Hoala, how about we do a quick recap for our guests?
Sure. So some takeaways on the HIPAA side. Fines are going up. Access to, well, the ability to get audited at random is now a reality. And coupled with ransomware and ransomware using Bitcoin, I don't think we're going to see a decrease in HIPAA violations occurring. Quite the opposite, in my opinion. And as far as email security goes, I've just been around this stuff too long. You need to prevent the user from ever seeing the phishing attack. And the only way to do that, or the best way to do that, is with a strong perimeter defense. And that includes a multitude of best practices and tools available. And we do recommend SPF records, checking how old the domain name is. I just call it domain age, just something we've built internally. And leveraging things like Google Safe Browsing so that you can see whether or not the URL within an email is a scam or not. And then, of course, nuclear option, all 100% max. That'll just really cut down on your headaches immediately. Again, it's not 100% fail-safe, but man, I can tell you 95% of the attacks going around are all catered to Windows PCs. And lastly, email security is an ongoing and vigilant endeavor. Constantly updating. I think we update, no, I know we update our systems every 2 minutes, 24 hours a day, 7 days a week. And that's the only way to stay on top of this game. Constant vigilance.
And I shared how a digital holistic platform like Optimity can really help to engage and support employees. So I talked about some of our digital solutions and best practices. I shared some of our tips and best practices on really how to keep the employee health data private and how we do that at Optimity. And just describing really holistic health can be just scalable and engaging for all of your employees. So just a reminder at this point, if you have any questions, please type them in the tool at the bottom and we'll reach out to you after the webinar. And if you're wanting to learn more about employee health strategies, please reach out to me at hturk@myoptimity.com, or you can visit our website at myoptimity.com. So I'd like to thank everyone for joining our webinar today, and I hope everyone has a great weekend. Bye.
Thanks, Hillary.